The next thing we're going to talk about in breast enhancement is implant location. I get asked all the time, well, where do you put the implants, Dr. D? Do you put them under the muscle? Do you put them on top of the muscle? Well, let's review a little bit about the history of this operation. When this operation was first conceived in the 1960s, all the implants were put under the breast and on top of the muscle because anatomically that makes the most sense. Unfortunately, due to limitations in implant technology, a lot of those implants got hard. They had too much scar tissue that formed around the implant and gave unnatural results. So plastic surgeons, being kind of a clever group, tried various modifications of a standard augmentation to see if that would influence the appearance of the breast or influence the happening of hardening of the breast. And so one of the innovations was, well, let's put the implant under the muscle. This was an innovation that started in the 60s, or actually started more in the 70s. Placing the implant under the muscle certainly seemed to decrease the percentages of the implant getting hard or excess scar tissue forming around the implant. But if you put the implant completely under the muscle, the implants tended to be a little on the high side. And of course, by being under the muscle, you got a lot of animation of the implants when you'd flex the pecs. The implants would literally do a bit of a dance. Most surgeons today are doing what we call partial submuscular placement. The top part of the implant is under the muscle, camouflaging the top part of the implant, and then the rest of the implant is just under the breast tissue. That's a partial submuscular placement, and that's certainly the most common location in the United States today. Some practitioners routinely put the implants on top of the muscle, just under the breast tissue. That's called subglandular placement, and certainly in select patients it has its advantages. There's less recovery, there's no animation when you move the pectoralis muscle. The trade-off of course is that you have less camouflage, so in thin patients that's really not an option because that's the last thing a woman's going to want to see when she's in a low-cut top is the ripple of her implant up top. The muscle tends to hide that. Or if she has really thick breast tissue, her own breast tissue will hide it. The other thing about putting the implants on top of the muscle yet under the breast tissue, subglandular, is in some cases that may accelerate breast sag, which sometimes can result in something that we call the rock in the sock. It's a very elongated breast that is not particularly attractive. The literature also suggests that implants placed under the breast but on top of the muscle also are slightly more likely to get hardening of the breast or capsular contracture. So no location is perfect. Each one offers advantages and disadvantages, and it's up to the surgeon to explain that to each patient and to help the patient pick the best location for her.